Idiopathic inflammatory myopathies are systemic connective tissue diseases which are characterized by symmetrical proximal muscle weakness, reduced muscle strength, and chronic inflammation in muscle tissue. These are rare disorders and affect more women than men. And although the peak age of onset is in the 50s, the disorders can occur at any age. The word juvenile is also used in the name when a child is affected by myositis. And adults with inflammatory myopathies have an increased risk of cancer, including cancer of the lung, breast, prostate, and ovaries. Causes unknown and autoimmune. Symptoms are muscle weakness around the neck, shoulders, and hips. Trouble climbing stairs, getting up from a seat or reaching for objects overhead. Also pain in the muscles, choking while eating, aspiration of food. The signs that are usually elicited are proximal muscle weakness, aspiration pneumonia, Gotron's sign or Gotron's papules, rash over the back of the fingers, elbows, or knees, and shaw sign as flat reddened area that appears on the upper back, shoulders, and back of the neck. Also photosensitive rash, heliotrope rash, nail bed abnormalities, mechanics hands, alopecia, interstitial lung disease, and calcium deposits in the skin as calcinosis. Investigations are creatine kinase levels, anti-nuclear antibodies, hepatitis B and C screen, HIV test, muscle biopsy, MRI scan of the muscles, electromyogram. The main treatment objectives are to improve muscle strength, to minimize long-term muscle damage, to prevent complications from muscle weakness, to reduce treatment side effects. Non-pharmacological treatment of physical therapy and rehabilitation to prevent contractures, avoidance of exposure to direct sunlight, appropriate feeding techniques to prevent aspiration. Pharmacological treatment for treatment of acute condition. First line treatment, you give prednisolone oral 0.5 to 1 milligram and per kilogram body weight, and then you give omeprazole oral in adults 20 milligrams daily. In children more than having a weight more than 20 kilograms, 20 milligrams daily, and 10 to 20 kilograms. You give 10 milligrams daily, and 5 to 10 kilograms, 5 milligrams daily. Or you can give esomeprazole oral in adults 20 to 40 milligrams daily. In children 12 to 18 years, give 20 to 40 milligrams daily. And 1 to 12 years, give 10 to 20 milligrams daily. And less than 1 year is not recommended. And also, you give calcium supplements with vitamin D in adults and children as required, or bisphosphonates in adults and children. Consult specialists. For the treatment of rash of dermatomyositis, you give the same medications I mentioned, and then you add hydroxychloroquine oral in adults. You give 200 to 400 milligrams daily. In children 5 to 6.5 milligrams per kilogram with a maximum of 100 milligrams per day. For the treatment of acute condition with steroid resistance, first line treatment, they give methotrexate or azathioprine, or you can give intravenous immunoglobulin or mycophenolate mofetil, or you can give rituximab. So all these medications, you have to consult a specialist. The referral criteria: so refer all patients to a physician specialist or rheumatologist.